screen. Just let me know. Are you able to? Okay. Are you able to see my screen? Yes?
Yes.
Yes. Yes. So already we have understood the impact. So today the very interesting part that how the treatment happens to all these whatever we have discussed. What are the these treatment all are designed with the help of research, with the help of some doctor, clinical, psychiatrist, psychologist, practitioner, with so many methods. This treatment, which will going to be discussed, it's already means this already researched. So today we'll try to cover what are the treatment stages, what are the treatment settings and modalities, and if time permit we will also discuss the preventive strategy and then that school based program and how motivation works for all this. So uh, treatment and prevention is like it's not a new concept. It's already like in ancient civilization, like in Aryans, Sumerians, or in South America. They previously used that opium and coca leaves or cannabis for that medical and ritual purposes. We know that drugs and that alcohol have been used for thousands of years for maybe medical or ritual or recreational purposes. Every country have their history of drug abuse means differently. If if I talk about India, where during that British rule, India saw an increase of alcohol and drug consumption due to that excise law. And after that post independence, there were some programs and uh, that committees to control this drug abuse. So what we are going to discuss here that most approaches are from Western countries, particularly that all are from like we can say the United States. Whatever today we'll discuss, all these approaches are from there, and it is like became very success for treatment. So we are using mostly all these methods. So let me just see how few are joined. Okay, are you there? Right? Yes.
Yes, ma'am.
Yes. So these, as we have understood so many concepts, but without treatment, there is no success. So this understanding this concept is, please be mindful. At least understanding this some very crucial and very important concepts. So after this means you can go for means after some understanding, you can at least have some idea that how a person should be means go for treatment. What are the approaches? What are the methods? So I think, do anyone have any idea that if we saw a addicted person, uh, what could be the treatment? Any means just common idea or any idea that what could be the treatment to a addicted person? If I saw any person who is addicted, what could be the treatment in basic idea? Do anyone have any idea?
Yes. Hello?
Yes.
Yes, thank you. Thank you so much for the lecture, Doctor. Uh, I think the first things need to do before need to counsel the person, the person, someone who is addicted.
Okay.
do the thorough counseling, and then
Yes.
yeah, to assess how far the person has gone with the drugs, and yeah, after that can go ahead with the yeah some the treatment that is like the recommendations of the psychiatrist and the doctor. I think that's what I can say. Thank you.
Nice, nice. Right, right. As you rightly said, that those are the main points, and these all are divided with some methods and some stages. That's only. But basic is that our main objective should be for the treatment is that we should take that the addiction as a disease, and we should accept that person's what the status. Then we should that we should take personal responsibility for the recovery for some time. All this should be the objective or goal of our treatment. So as I told that these methods all are from mostly United States. So there is a, I will present my screen because it will be easy for you to understand. These are some research methods. Okay. Yeah. So so there is an excellent model designed by James and his team. This model explains how people change through recovery journey. As we have discussed, do you remember that that addiction has some phases? Do anyone recover that addiction has goes that addicted person goes through some phases? Do anyone uh, remember what we have discussed? Anyone can say that a addiction addicted person goes through how many phases, or can anyone say last three classes? Because that is interlinked with this concept. Anyone? No, no one. Hello? No one have that idea. Okay, okay, I will tell. So we have discussed that addicted person goes through early stage, middle stage, and chronic stage. Right? Remember? Yes?
Yes, we have remembered.
Yeah. Okay. Same, because after understanding that stages, so this model, which is designed by, I told you, this they designed such a model that that model they divided in six stages, where we'll be able to recognize that how people change through this treatment process. Like when a person is addicted, I will make it very simple. Like when a person is addicted, that phase is gone. Okay, now if that person comes for treatment, now we have to see that person through we'll break that treatment into some different stages so that it will be easy to catch that addicted person and his behavior, and do the useful treatment methods. So that he designed a model where he divided that in six stages. As I mentioned, that's the six stages. This stage is nothing, but they just say that first stage they will have like pre-contemplation stage, which is denial stage. Means when that person comes, that person never recognize that they have a problem. They will deny that no, we don't have any problem. They will resist the change. They won't seek any help. Their attitude will be that way. When the person just came for treatment, they will be like they don't need any help. They will deny that no, this addiction is okay for me, I am doing with occasionally. They will say that yeah, I can quite quit anytime, I just drink for relax. Already we have discussed that will be the denial stage. But then what we'll do, then our aim is to realize them the main problem. That is the second stage. Maybe there will be some conflict or something, but with our skills we will make them realize that yes, there is a problem. That is the second step. Then after that we will go for that, we'll plan, we will understand that addicted person, how that alcohol start, what are the history or any stigma behind that, what are the consequences he is facing. All this we will plan, all this assessment we'll do with him. That is the preparation stage for us. Then after understanding his history, his stigma, his consequences, means his depression, his stress level, all those things, then we'll go for the another, that is action stage. In that action stage we will that where the treatment will happen on. There we will have some therapy, we will give them some medicines, we will have some support groups. There the changes will start slowly. Again lastly, then it will that we will continue all this process throughout the change. That is the like termination stage. So these are the just, they have divided the recovery in 6 stages, so it will be easy for as a social worker to do the treatment. It will be easy. Did you get my point? Or shall I give some more examples? Yes. Hello. Okay.
Yes.
So okay, yes. So my question is, if every addicted person should have all these stages, should they go through all these stages? No.
I,
Maybe some
I
person.
think
Yes.
I think no, like what I think no,
Yeah.
in that like after reaching some stage and you find that the person is, yeah, faring well, you can at least yeah, you can, yeah, you can stop from there, and you go through another guidance, because you cannot continue all the stages even when now the person has reached, when you reach like stage 4 and you find the person is doing well, yeah, so I think you can stop there instead of continuing to the last stage. Thank you.
Yes, 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 yes. Rightly said. This is for our understanding, because we have to intervene. We don't know how a individual we will. So these are the basic knowledge we will have. But practically the addiction is really very complex. Some will come with like some many withdrawal symptoms, maybe some will come in a denial stage, maybe some will come in that last stage. So but we should, as a social worker, we should have all this understanding, so that any individual with any type of symptoms will come and we can able to intervene them. So we are understanding the all the concepts for ourselves, so it will be easy to treat any type of addicted person or in any stages they may come to us. Right? Did you get my point? So this is for our understanding. Okay. Right? Yes, 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 yes. because we have to know all the scenario, then only we can treat any type of person. So this whatever we will learn, that doesn't relate that every person should have all these symptoms. No, real life person maybe have something, or maybe they don't have all, maybe they have all. But for our understanding as a social worker, we should know all these stages, and we should understand all the concept. So we'll be able to apply whatever require, whatever adequate, or whatever the best approach for that person, right? So we will understand the all the concepts. So where we okay. So already that is really, I told that excellent model which outlines all these recovery plan stages. So this, a person starts from denial, then this agreeing stage, then they will go for that, slowly they will go for action, then they go, then that will continue termination, and finally that recovery will happen, because it's a long process, it's not a one day process, it's a long process. So find that the three stages of, the main three stages of treatment plan, which is designed, it's designed by scientific research, so many psychological theories, and with so clinical practices, with over a long time they have designed these three final treatment stages. That, which one? Number one is intervention, then number two is rehabilitation, and number three is maintenance. So these three stages should be in our mind, that if a person comes for treatment, we have, we can have intervention, rehabilitation, and maintenance. These are the three main stages for a treatment. As a social worker, this should be like should be in our mind every time. So some people, we, they need intervention and they will go for recovery, and some people we have to do the rehabilitation, maybe they will able to go for recovery, and some people we have to go for the three stages: intervention, rehabilitation, and maintenance. After that they will go for recovery. So it is very important for us to understand all these three stages, right? You are, I think, all with me, right? Just give some symbols. Okay. So can anyone tell me why they have divided in the three stages, not a single? Why this they have divided in such three stages? Why we need to understand three stages? Why not a single time? Like, why three stages? Why they break these stages? Why not three? Just answer me. Why means why they make these divisions? Any general means why they make these divisions? Why? Anyone? I think you can
Yes,
relate.
ma'am.
If you can relate, you can answer. Why this they make these divisions?
Yes, ma'am.
Yes.
Hello, ma. Am I audible?
Yes, yes, very audible.
Okay, ma. Because different individual need different treatment. Like some patient
Yeah.
need only the treatment is to intervene with them. Some need to go to rehabilitation center.
Right, right, right.
Yes, that's what I understand.
Yeah. Yes, that's the thing only. Breaking with these divisions, it is easy for us, and it is easy, and it is for, and it is adequate best treatment for that addicted person. So it's very interesting. Just have some mindfulness, so that it will be very easy. We'll cover these stages, and after that, like, we will be so confident that yeah, we can do this treatment, and it will really means gives us very relaxation, that I am able to do the treatment. At least I have the knowledge, so at least I can help in any way. So if you understand all these stages, it will take some time, but it will really very interesting thing.
Yes, excuse me, doctor.
Yes, yes,
Yes, I'm having some question here.
yeah,
Uh, like for example, uh, if a patient, you have a patient who have been taking his drug, let's say he's supposed to be taking his drug injection for like every month,
okay,
and you have gone for like 3 months without coming, and the patients appear, uh, and you ask the patients, and it tells you that I was not, I didn't want to take the drugs because you know I just feel like not taking it. Could that be under denials, or what kind of what stages is
yeah,
that like?
yeah, good, good.
Yeah,
Okay,
thank
okay.
you.
Okay, so did anyone want to answer, or shall I? Because it's very practical questions. If you related all, if you remember, or you can relate all that concepts, you can answer very easily. It's a practical. If he's asking that one person came and he told that now I don't want to take any drugs, right? So what could be done next, huh? So, so let me. So if that person already have taken some sort of drugs, but now he is telling that he don't want to take any drugs. But denial means he is already crossed the denial phase. Denial phase means he he don't want to acknowledge that drugs is a real problem for him. So already he is acknowledging that he don't want to take drugs. So next he want to proceed, how next steps means he want to lead a life without drugs. So that is the already he crossed the denial phase. So he want to recover now. So now the next is only we can do treatment with him. Already he I mean the denial phase is changed, finished for him, because he acknowledged his problem, so he is ready to take the intervention. So did you clear?
Yes, thank you.
Yes, yes.
What you
So
do?
that in that case we have means it is very easy for us, because he is already with us. He is with us to take the treatment. We don't have to break the denial phase, because he already acknowledged his problems. Because men breaking that denial phase is very much important, because some people they don't even acknowledge that the drug is a problem, alcohol is a problem. So that we need lots of counseling, lots of motivation to break that phase. Because but if a person comes with already motivated to take to quit drugs, so it is very easy for us to make the treatment, because he is already with us. Okay, so the main three stages are, which I have told, that intervention, that rehabilitation, and maintenance. So intervention means, let it's, I will make you really simple, that I have mentioned that it's the breaking the denial and seeking help. I have written already, you can see that it is the stage where we have to give some awareness through, it could be through like educating or through any way, but we have to give awareness that we have to break the denial phase and let him seek help. So let's take an example. If some person is very much addicted, so what we'll do in the intervention phase? First, we will first identify that what he has the problem, which drugs he was using, and we will educate them about that this is not good for him. For that we have to gather evidence from that person, that what was the consequences he was facing, uh, how his family is affected, how his personal life is affected, how is his physical health, how is his emotional health, all the things we have to gather. And that is gathering evidence, because we don't know about that addicted person. So we will gather all the evidence. Then we will make such counseling sessions where his means friends or his parents or his relatives or any person should be present, for that to encourage him to accept that addiction is a problem and accept for that further treatment. This is only means in first starting we can do all these things. Look, because if it's in, let's take a practical example. If we interact with an addicted person, so if suddenly we will give them, okay, take this medicine or do this all this therapy or come to with me, maybe that person will be so much afraid or something, because he is not in a normal stage, so he won't take all that methods or any sort of therapy from us. So first we have to be some sort of relax with that person. We have to talk with, we have to build a trust, we have to understand that person through his family, through his relatives, through his colleagues. Then we have to talk such a way that, and with proper evidence, that we cannot tell him lie or something. With such proper evidence we have to talk with him such a way that he will be able to understand that addiction problem, and he will agree to take the next treatment. Because if we fail in this intervention stage, that person won't come for any other stages. So in this is a very first step where we have to motivate that person such a way that he will be agree with us for the next some days or some month. Did you get my point? Anyone?
Yes, ma'am.
Yes,
Yeah.
yes. Because it is we cannot directly jump to treatment. Okay, come for this therapy. We cannot directly jump, and we should not jump for that. First we have to talk in a motivations, their motivation skills. Our counseling should be such a way that we will able to get his problem, though he will tell or not. But as a social worker, that is our skill. We should understand his physical problem, or psychological problem by talking in a such a way, or we will take help from his parents or nearby any relatives or any colleagues. That is the intervention stage. Okay, so once that person is agree, okay, I will go for treatment. Once that person is agree, what we will do? Because already that person is addicted, maybe he has some physical issues, maybe some labor problem or some other problem. So first we will make that person detox, detoxification. After that person agree for the treatment, we will go for the detoxification. Anyone heard this word, detoxification? Detox? Anyone?
Oh, ma'am.
Just no.
Yes, it's a process whereby the body can either go under excretion of harmful substance, or it can be induced by chemically induced products or some other natural products.
Right. Because already in our last class we have understood that the person who takes alcohol heavily, there were so many changes in that person. We have already understood that psychological changes, physical changes, emotional changes. So we have to remove that all the chemicals from that person. We have to remove that all the chemicals. So we have to give some such a medicines which will help to remove that chemicals. That process is called detoxification. Because without that chemicals, that person won't be able to understand what we will say or what we are going to do, what is more our motive. So first we have to remove all those chemicals through the medicines. That is called detoxification. So once that person is ready, after intervention, we will do, and with his permission only. Without his permission, we can do. With his permission, he we will go for this detoxification process. So I think up to this you all are clear. Intervention, right?
Yes, maybe just one more question.
Yes.
Yes, I was asking like after the intervention,
Yes.
do you need a consent from the patient or a relative for you to for him to have a detoxification?
Yes, definitely. Because as I told, no, maybe that patient could be addicted to any type of drugs, and maybe that person, we already described, maybe that person have HIV or anything. So without any permission, this social worker rule that we should do all the things with some ethics. That's our principles. Already we know that social worker principles with ethics and with concern. Whatever we will do with concern and with ethics only. We cannot do anything from our side. No, we cannot do. It should be that patient or patient's close relative, close parents, wife, anyone. We cannot do it from our side. Either that patient should agree, consent, or that parents or relatives, anyone, relatives also not like long distance relatives. Though without consent, we won't do anything. We will only do motivation or, but all the things that person should get consent. If that person should not means they won't give the consent, maybe this detox will serve in negative way. That's the means medical things. If that person is not giving consent, if we give some detoxification which is unethical, but that will result in the negative way. So it should be in some consent. If that person is not agreeing, we have some others way, through family, through social supports, we will first make him convey to take this medicine. Are you clear?
Yes, it
Yes,
was
yes,
clear.
yes,
Thank you.
yes. It's our principle. Okay. So okay, okay, yeah. So we have finished detox. So next, now the person is ready with intervention and detox. So what we'll do next? Of course, we'll go for the next rehabilitation. Sorry. So which is like if my question is, if I will do intervention and leave that patient in that stage, what will happen to that patient? If I will do only intervention and stop my treatment, what will be happen is that person will get recover automatically. Did you get my question? No. Maybe some patients will go, means in that intervention process only they will be so much motivated that they won't take the drugs. But there will be so many patients who will again continue take that drugs. So next we have to go for that rehabilitation phase. What is rehabilitation phase? In this, that we will go for so many therapies, counselings. That is, this is the recovery and therapy phase. So this is called rehabilitation phase. Of course, that rehabilitation is essential because it's provide support, therapy and lifestyle changes, because that person, addicted person, don't know how to behave without drugs. That person don't know. Already we have discussed that withdrawal symptoms. Do you know, anyone can remember withdrawal symptoms, right? Already we have discussed withdrawal symptoms. Because that person don't know if that person leaves drugs, what will happen to him. That person is total unaware and he don't know that what are the other life or what are the other activity rather than taking drugs. That person don't have any sort of idea, and that person is totally blind that how should he quit that drugs. So we will help them in this rehabilitation phase. We will give them therapies, we will talk to them, we'll give them counselings, we'll give them sessions where that person able to relieve his stress, his trauma, his problems with drugs, and all sort of things he will discuss here, and he will try to change his habit slowly. So in this phase, as a social worker, we will do some sort of things for us, that is evaluation assessment and primary care and extended care. In this rehabilitation, we will do some evaluation assessment and primary care. What is this evaluation assessment? As a social worker, I have to know that how that uh, drugs is severe in that person, how much that person is alcoholic, and what are the stages, means how is it severely alcohol or very less, or how that alcohols affect him. I have to understand. For that I will do some evaluation assessment. So there, for that I will use some questionnaires. I will ask that there are some already pre-described or some questions. With that questions, I will be able, as a social worker, I will be able to understand that phase of that addicted person. It's like some screening test. I will do some screening test for him. I will understand his status, his physical status, his psychological status, his social status. That I will do through some questionnaires. That's called evaluation and assessment. With his history, his present status, I will plan my treatment plan. So I will do, before that I will do evaluation and assessment. Did you get this point? Yes, students?
Yes, ma'am.
So I will give an example. It's like a 30 years old
Yes.
man who is struggling. Okay. Anyone want to speak? Okay. So my example is a 30-year-old man who is struggling with alcohol dependence. That person joins a rehabilitation center. I hope all have some idea about rehabilitation center. Then after that, where he goes for detoxification and counseling and therapies. These counseling and therapy sessions all goes in that rehabilitations, because in that rehabilitation center we will give some therapies, that CBT therapy, some therapies are there which we will also learn later. So in that, this is called rehabilitation. Maybe we will give group therapy or some individual therapy or behavioral therapy to understand his stress, the level of stress, level of trauma, level of depression, what are the withdrawal symptoms he has. All this we will understand through our counseling, through our therapies. So this is the rehabilitation stage. With our evaluation assessment, we will understand that person and we will give them whatever the required therapy that person. Maybe mostly we will give them cognitive behavioral therapy to understand his thoughts and drinking patterns, drinking habits, to change his habits. We will give them therapies. It may be weekly, it may be in month wise. So here we will give them primary care, all these things. These are the rehabilitation stage. So what we'll do after this rehabilitation stage? Maybe some person they recovered in this stage, they don't need, they will recover, and maybe they will say no, we don't want any further treatment. So we can stop there, but we will make them, educate them. There is a chance that another thing could happen to them. It's a practical question. Can any person do with some days? Can some person quit drinking? If I give some therapies or some sessions, is that person able to quit drinking? But what will be the next consequences? Do you have any idea? The first, any idea that if intervention and after rehabilitation, if that person tell, okay, I don't want any further treatment, I want to, I am okay now. So, what should we do there? Any idea?
Yeah.
Yeah.
Okay, thank you. I think you should not just leave the patients. You need to monitor for some time. Yeah, until you see that it's now okay.
Okay, okay, right, right, right. Because we already understood that addiction. We have understood. Okay, because already we have understood addiction as a process, the whole process addiction. So addiction is a long term process. It has so many effects. So after intervention and rehabilitation, maybe that person feels okay, but we know that it will take time. Maybe there is a chance again that person starts abusing drugs. Is there any chance? Yes or no?
The person can go over that. They can start taking drugs.
Yes, very
There
good.
is a possibility.
Yes, yes. There is a very much possibilities that the person will again start. So there comes the maintenance stage. There comes the maintenance stage, because we have to understand all sort of possibility, and there is a very much possibility where that person will again come back for the drugs, maybe that, and that is called that relapse. That is, that phase is called relapse phase. What is relapse? So relapse means to return to that substance use after a period of after a period of absent. So that is relapse. So as a social worker, we know all these things. So we will go for this maintenance stage where we will have treatment like aftercare, relapse prevention, and domiciliary care. It's a long-term care where that person will have again therapies and support groups, and we will teach them healthy lifestyle changes which will be for long-term use. So this maintenance phase also very much important for individuals who are addicted. So some I think, can anyone give an example of any experience with the relapse? Any of your experience or surroundings? Did you see any person having this relapse, going back to drugs addiction after treatment? Any of you such kind of experience with any persons?
Yeah, like regular check-in with healthcare providers or therapists.
Right. Okay. So many of us means mostly the addicted persons, they don't know that how that drugs is playing with them. So there's a very important for us to make understand them. This is the phase where there is very much chance of relapse. So we will give them some coping mechanism, different coping mechanisms, different strategies for a long term recoveries. And that coping mechanisms may be give some, like we can teach them to have meditations, exercise, or how to have self control, and how to have that understanding self. All these things we can teach in this maintenance phase, and we will make sure there will be some support groups for them. Maybe they will be their friends or anyone to at least guide them in this, at least for some months or at least some years, so that there will be no chance of the relapse. This is the maintenance phase. These all the things we have to take care in this phase. After this, we will be like, okay, that person is going for recovery. So for your better understanding, I have given this table. Are you able to see? Yes?
No.
No? Are you able to see my PPT?
No.
Okay. Yes. Oh, sorry. Okay. So we were talking about maintenance phase. So now, are you able to see?
Yeah, now it is.
Yes. So
Yes.
here, for your
Yes.
easy understanding, I have mentioned that 3 phases: intervention, rehabilitation, and maintenance. Here you can see the difference. First we will recognize the problem, then we will go for some sort of therapies. I have mentioned that CBTs, some therapies. Then we will go for the long term, which will prevent relapse. And every time the support system should be there, which may be some, it is like interchangeable. The family, friends, that peer groups, and therapists, doctors. Intervention should be very short time, and rehabilitation also short to medium, but maintenance we will give them such coping mechanism or a lifestyle which will continue throughout the long time. That person should able to do all those things throughout a time, like for months, for years. So here I will just ask, till now, did you get these three stages? Did you have some concepts about these three stages?
Yes, madam.
Any questions from these three stages? Any practical questions or anything coming to your mind? Just think, if you go for treatment for an addicted person, what are the things comes to your mind? You can ask. Because these three stages is very much important for social worker to understand.
Yeah, I don't have much, but I think maybe let me talk about that part of the after the interventions, and you maybe you're on the stages of maintenance, like forming the focus groups, and also other form of maintenance. And yeah, I feel like it's a kind of a long process. And how do you manage the person like during that maintenance? How in terms of cost, and also yeah, like especially the reliability of the patients, to make the patients keep coming, and also you engaging with the patient. Thank you.
Okay. So, okay, I got. But okay, can you repeat like your questions once again?
What I
It,
was saying,
yes.
during the maintenance stage, uh,
Okay. Yes.
yeah, when yeah, of the patients, like when forming a focus group
Right.
discussions,
Right.
yeah, forming a focus group discussions, and like to keep them engaged,
Okay.
keeping them, and also keeping them, like monitoring them,
Right.
how yeah, how they're doing in terms of the treatment. So what I was what I try to mean is like how the cost, like
Oh.
how do you manage the cost,
Hmm.
the cost.
Yeah. Okay. 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 Uh, anyone? Anyone have any idea? So mostly
Yes, Bob.
Yes.
And through you, Madam. I don't know the setup of the different facilities, but mostly that when you're assigned to care for such patients, you say that you're sponsored by the government, or there is a mission hospital which you work under that, so the cost are made either by the government or mission or non-government organizations that to support the patient or the client. However, there are other private institutions that the patients are able to pay maybe for specified kind of care or kind of treatment. So to answer your question, like in our local setup, there are three modalities. The first modality is that the client or the patient or the guardians will meet the cost through a private agreement with the social worker or a psychiatrist or any mental health worker. The second option is that this client will report to a government facility where all patients are covered under the free government services. The third one is this patient may be operating from an NGO facility or a CHAM, a Christian Health Association, some kind of where the cost also made by those two specific organizations. So I don't know in the case of your setup, but mostly this is how the costs are being made. Patient pays or others are held by the government or the non-government.
Right. So, with your points, thank you. I just want to add that rightly here, with regarding that cost, that settings matters a lot. As he told that maybe here that settings could be uh, outpatient treatment, and for inpatient rehabilitation setting, maybe where somewhere hospitals. So it depends upon that in which program that is running. Maybe it's if that government program that have some cost from governments, but if there that institutes where that some private institute, there sometimes that patient have to give that cost. So mostly it's in general, mostly most of the case it is in they're going for the government. Here I have an example. One of my friend, he wanted to go for that treatment, so he chose one psychiatrist who is working in a private. So he paid all the expenses. So in your questions, that focus group discussion mostly may all those as conducting with the government programs. So uh, the cost will be on that from that programs. Did you get, Bob?
Yes, I got it right. I think yeah, for maybe inpatients and outpatients, but now like for in case of the private facilities where someone just have to come visit, and I think they may need more care.
Right.
Yeah, they
Most
may need more care, and if not, yeah, I think
mostly we prefer like mostly we have a thought that in the private there will be good care, but in government we don't get such type of good facilities. But it is not depend on the government and private. That care is like it depends upon the settings, social worker, all sort of things. So per budget, it's mostly depending on the program, or if like individual who wants to get him treated in private, that cost on him only, him that person only. So here also comes another concept which you already uh, put, that is that settings matters a lot. Where we are get means where all these treatment happens, that depends upon the settings. As I mentioned, that treatment settings means it refers to the environments where that addiction recovery occurs, including that hospitals, rehabilitation centers, outpatient clinics, or sober living homes. We have so many examples from our surroundings. If we go for means all these programs, if we work under these programs, we work under government organizations, we will be mostly means get placed or get work under all these settings. So what is an outpatient treatment for means some it for some mild cases, that is where that the person needs some weekly therapy sessions or some family counselings, support groups. Example may be when a person with early stage of alcohol dependence, and he can quit within some with the help of some counseling and support groups. There, that is the outpatient treatment. That may be in could be happened in hospital. Then what is inpatient rehabilitation, where means that cases is very much severe, moderate to severe, where that person need 24 by 7 medical supervision through a structured therapy. uh, Example like when we have discussed means when a person having severe withdrawal symptoms, that person need inpatient rehabilitation, where that symptoms or the addiction is very much severe. First we have to go for that inpatient rehabilitation. After, maybe we will take them for uh, outpatient, but for severe cases that inpatient rehabilitations are important. Okay, so these are some means some out of so many settings. These are the some basic settings which I have mentioned, and of course he told a lot of things already. We understood that. So next, as he mentioned one word, that is treatment modalities. He mentioned that modalities. Do anyone know that word, or is that a new word for us? That modalities. I think Francis mentioned that modalities.
Yeah, I think it's just the English played around. They are like treatment models. I think that should make more sense.
Right, right, right. So for everyone, like for easy understandings, these are the different approaches or methods to use treatment that are called treatment modalities. For like some other way I will say, like every individual is really different, their addiction is different, so we don't know means if this how that person will be reacted to these treatments. So we have designed so many modalities, so many approaches, so many methods, so that it will fit to different type of individuals. So we have so many modalities because it helps in address all the aspect of a addiction, because we already discussed that they have physical aspects, maybe emotional aspects, social aspects, and behavioral, and so many aspects. So we cannot treat a person with only one rules of treatment, one only one treatment style. We cannot do treatment with every individual because their reasons are different, their consequences are different, they have different symptoms, everything. So only one sort of treatment is not applicable to every individual. So there is a here we have mentioned six modalities, means six different approaches or six different conditions, six different methods. So we don't know, whichever required, we will go for that modalities. So I will give example, then you will be more clear with these modalities. So here I have mentioned that modalities are different approaches. So there are, here I have mentioned 6 modalities: pharmacological, social modalities, psychological, behavioral, psychodynamics, and spiritual. So let me make you simple that some people, they believe in spiritual things, right? Yes or no? Yes?
Yes,
Yes.
yes.
So if I know, if I will do treatment with spiritual methods only, that will be very easy, that person will have recover. So that's a spiritual modalities. So if some people are very much emotional, they only understand the emotional things, mental health they have, so I will go for psychological modalities. Their spiritual modalities may not work, so I will go for psychological. So that's the main reason we have so many modalities, so many methods. So if we have knowledge of all the modalities and all the treatment stages, so with all this knowledge, like if I encounter, if an addicted person, with some sort of counseling and session, I will be able to understand which modality will work best for that person, and which treatment phase is best for that person. So as I told earlier, as a social worker, we should have all this knowledge, all this understanding, and it is not a difficult. Maybe if you if you are hearing for the first time, it will be little bit difficult for to understand all this concept. But as I told in my first class, if you connect all these to your real life situations, real life surroundings, it won't be like any problem for you. You exams are nothing. You can write from your experience so many things. So here comes with the modalities. Did you get that concept? Why these modalities come for practitioners? So a
Come
well
again with the question,
structured
please.
treatment plan. Yeah. Did you get why these modalities came? Did you understand the reason behind all these 6 modalities?
Is it not due to the theories to understand from people's perspectives?
Right. And if you have some insight about each modalities, it will be uh, very much easy to understand, as he told, people perspectives. As I told, like some people, they will very much social. uh, so now we will understand at least some modalities. Like first I have mentioned pharmacological modalities, which is like medicine based treatment. The first one is, which is medicine based treatment. What does that mean? That means uh, that some, if some person addicted to heroin may take some medicine, that which is methadone, daily, to reduce that wilted symptoms and cravings. So this is a medicine based treatment. This is called pharmacological modalities. So many medicines are there for, like alcohol dependency, they have some different medicines. For opioid addiction, they have some different medicines. For smoking related, they have some patches or gums or nicotine replacement medicines are there. So in this modalities, we'll have give them some medicines, that is pharmacological treatment. The next one is social treatment modalities, where we will have some community programs, family involvements, peer support groups. All these we will do in these social modalities, which is community and family based supports. Mainly that is, it is community and family based supports, where family council and interventions we can do in that rehabilitation centers. We can apply that social modalities. Here comes psychological modalities, where we will address that emotional well-being, self-awareness. We will address that underlying trauma, stress, and some disorders like depression, anxiety. All the things we will address in these settings or in these modalities. All this we can do through that therapies or some motivational interview, trauma therapy we can do. So it's a psychological modalities. Another interesting, that is a behavioral modalities. Behavioral modalities means where we focus on the changing behavior and habits of that persons with that substance. So here we will teach them that some stress management training, some we'll give them some social skills training. We will give method on how to control the drinking. We'll teach them how to do that self control. All this we will do in this behavioral modalities. Next, the fifth one is psychodynamic. Psychodynamic is, here we will go for that psychotherapy approaches, where therapies means maybe we know that that is one-to-one therapy. Like we will focus on one-to-one sessions, psychotherapies, that, which happened between the therapist and patient. Maybe it is like group therapy. We will ask example, maybe in rehabilitation center, uh, where group therapy sessions, where uh, one individual can share his journey to all the groups, to all the support groups, and everyone share each other's journey of recovery. It's a group psychotherapy. Individual psychotherapy, where a person only shares his feelings to a therapist, that is one to one. It could be happened in any type of settings. Mostly it happened in rehabilitation settings. Are you following me?
Yes, ma'am.
Maybe these concepts are little bit but it will, if you go through that materials or you practice, then it will be like used to you. Okay, in that psychodynamic we can do some activities, group activities. That is also in a part of that psychodynamic modalities. Then last one, already I told, that spiritual modalities, where we can go for that spiritual connections. We can discuss that personal growth, self reflections, all these things in that spiritual, that faith, the meaning based recovery. This is called faith meaning based recovery, that spiritual activity modalities. So uh, these modalities will help a social worker to have that, to understand that there are lots of way, lots of method to do the treatment first, but we have to understand that where that individual lies, where what is the status of the individual, then only we can have, we can apply any modalities. It could be that a mix of 2 3 modalities, or it could be only one modalities. It depends that case of the addicted person. So here I want to stop for some time and ask anyone have any questions.
Hello, madam.
Yes.
Yes, I would like to ask, when would you know as a social worker to treat a
Yes.
patient of who is having this mental issue? Because we know some of the cases will be handled by the psychologist, psychiatry, and so many other branches of the social sciences. So when is the appropriate time to handle such a case as a social worker? Thank you.
Yes, it's just a question which is like many people don't think about that persons who have mental disorder, right? Mostly you are talking that they have mental disorder problems, or disabled people. Are you covering both type of patients, right?
Come again, please, with the question, please.
Yes, yes. No, no. I'm asking, you want to know about that disabled person with mental health disorder people, right?
No, ma, she is asking about the intervention of social worker with the psychiatric department.
No, no. Actually, I didn't get properly. Maybe can you? Yes,
I think Victoria is asking to say,
yes,
when we are dealing with issues of drug and substance abuse, in
yes.
most of our setups, these people, they would tend to develop some permanent mental disorders. Others are
Right,
temporary, but the primary people that they meet to be treated, they are doctors, psychiatrists.
right.
So where do we intervene
Oh,
as social
okay,
workers? Yes, I think that's what Victoria wants to know.
okay,
Where
okay,
do we come
okay.
in?
Sorry,
Yes.
sorry, because yeah, I did, I got. Okay,
Exactly. Yes.
yeah, yeah. So okay, so social worker, mostly they we are placed with settings with we social worker, we could be as a counselor. So if that person go for that psychiatrics directly, though if as a social worker, if that person have done some extra courses or some that required course, maybe that person with social work knowledge, that person became maybe any psychiatric, so there that person can play role. But here the intervention comes that mostly in that rehabilitation or intervention, we have to motivate that persons there. First the social worker role came, because that person, that all these medicals or all these detox prescriptions or drugs, prescription detoxification, this we are not eligible to do. We don't have that degree or we don't have that certificate, we are not eligible to give any means medicines, prescribes medicines, but we can do it with the therapies, or we can do with that sessions. All these things we can do. So there we can do that intervention, rehabilitation and maintenance, but we are not able to give any sort of medicines prescribed if we are not certified for that. For that certification we have to go and do which is required courses. Otherwise, for those people we can intervene in any stage. If we come across such a person, we can go give them intervention, we can give them rehabilitations, and we can give them maintenance. But for typically such people with mental disorder, we have to go and bring to them that clinical psychiatric people, that doctors who are certified and who will do that treatment only. We can bring those people to, means we can play a role like we breeze type. Did you get my point?
So, madam, are you saying that our first engagement, that's the engagement stage with the client, when we realize that the person has an issue with at a mental state, then we have to refer that person to a psychiatric or psychologist. Is that how it is?
Right. If we have already that degree, we can intervene. But if we don't have, we can do our starting interventions, and if because that is mental disorder. So if we have that degree, we can do all sort of counselings or CBTs, all the theories. Because if I am only a social worker, I have just completed social worker, my master in social worker or bachelor's in social worker, I don't have that much certified to give some medicines which is required for the mental disorder. I am not certified for that. But if I do, if I am certified, then only I can give some medicines which will decrease that mental disorders, all those things. But as a BSW or as a master in social worker, we can do all this intervention which we have discussed. For the specific, we need to go give means intervene with them with psychiatrist or psychologist. Some person who have a BSW, bachelor in social worker, then master in social worker, and they have degree with that psychiatrist and sociologist, they are eligible to intervene such type of people with mental disorder. They are eligible to give some medicines which will able to relax them. But as a bachelor in social worker or a master in social worker, we can only intervene in those stages. Did you get?
Okay.
Yes, we understood. Victoria, just to comment on what Madam has already highlighted. If you go back to our
Okay.
first year, I believe there was a point where we are discussing the role of a social worker in our communities and in our societies. To this effect, my understanding is to say that now that we have known that our societies are in problem, that our citizens have got a problem, our first law is at least to recognize those problems, at least to discuss with the communities or individuals about the problems that are facing. For example, in this case, drug and substance abuse. In most of our setups, young people, the old people, they don't even recognize that excessive drinking may be a mental problem. So our first intervention is to intervene to prevent one from becoming an alcoholic. Now we
Okay,
can
creating
do
the
other.
awareness, the harm
Yes,
of
awareness.
alcohol.
Exactly. All right. Now, when this case is out of our hand, that awareness cannot help this client. The social, the spiritual modalities cannot help this client. It needs a pharmacological modality. That's when we are supposed to refer this patient or this client, because we are not eligible to prescribe medicine. So it's also another role of a social worker to link the facilities with the society or with our people. Now we're coming in to say, okay, I've done my part. I've given the awareness. I've highlighted the dangers, the preventive measures. But now, since you are sick, you need to meet a psychiatrist, and let's go and meet the psychiatrist. Here's psychiatrist A. You need to pay. This one is for free. This one we can maybe ask funds from point B so that you can be assisted. So I believe we are a gap, we are a bridge in between those services that we cannot offer and those who cannot know where to get the services. I believe, from my understanding, is that we can intervene at all point, because if you see that even this patient is done with the treatment modalities, you need to be maintained, to be reassured that it's going to be okay, and it needs to be reassured that we also need to be assured that he's not going to go back into the behaviors that he used to do. So we have to come back again. So, okay, how have you been treated? Are you able to cope with the treatment? Are you going to live well, so that you should not affect or affect others that may have been seeing you as an icon? So to sum up, we can intervene at all stages, so long as we maintain what we are qualified to do, and not to do what we are not encouraged to do.
Thank you very
Right.
much. I'm so pleased.
Yes. Yeah, as he told lastly that we should know that what are our boundaries, what we can do and where we need to do all those things. Because though as a social worker we need to solve that person's every problem, but that is something which is not in our hand, and which is not we should do. We are not. We should not do that. So we can have play a role like he told a breach. We can give them every sort of options which is available in that society, in that communities. We can make aware them for like everything, but which is we are not certified, we won't do all those sort of things like prescription of medicines, all these things, because they are specialized person for those type of treatment, right? Did you get?
Yes, please. Thank you.
Yes, thank you for such questions, because this will make us much clear that what are our roles. So here,
Yes,
uh,
another question, madam, before you close on this one.
yes.
A follow-up to Victoria's question. We have done all the interventions that were supposed to be done. We have done the awareness, yet we have met some other people who have fallen into alcoholism and drug addicts. We have helped them to cope, to live positively. We have tried to find solutions. We have tried to link them up with professionals that could help them to get better. We have made follow-ups, and at the end of the day, it happens that this patient getting back and back again to the same problem that they used to be. In other words, we can categorize them that they can't be treated, they can't be helped. So when we reach that bar, that climax, what should a social worker do? Should we abandon them, or should we hope for redoing the same cycle that maybe these people are going to change, or there is a level where we can say, no, I think we have done all the interventions. This one is untreatable. I just want to know for progress sake.
Okay, nice. So yes, that's a real practical real scenario where that person is relapsed many times, and what should we do? Anything, any idea? This also means any. I have some idea, but can anyone help me to give any idea? Okay. Okay. So here, yes, yes, please, anyone. Okay. So here we have to see again, like it's a cycle. We have to see that first, what are the main triggers? Why that person is, means why all these treatments? Why is all these phases? While all these efforts is not applicable? What are the triggers, or what are the that weakness, or that from for that person, where that we have to understand that triggers, why that person, which emotional trauma or anything which triggers that person to come back to the stage 1. We have to reassess our treatment plan with that, because we have so many therapies with so many modalities. So again, we have to understand that why that person's logging with that moods, that thoughts, and why, what are his daily activities. We have to notice that all the symptoms. Again, we have to work on our reassess plan. We have to take that support system again. Same things we have to do. And here this time we have to be more careful about that coping skills. We have to apply different coping skills. We have to understand that is that person is really in a denial phase, or something different in his mind. Through that psychological intervention or that therapy, we have to understand again. It needs a high level of care. If that patient is not recovered through that traditional method, it's all this we have to reframe that relapse program, that assessment. We have to reframe again, understanding that current scenario. Again, we have to reframe all our treatment plans, right?
Well understood, ma'am.
Okay, do anyone want to add some points in that?
Yes, ma'am. After
Yes,
we
please.
done what, as after we done what we have to do, is there any need for referral to rehabilitation center for further treatment?
Yes. So some people means they won't be don't want to be go for that rehabilitation again. So here we have to take that support of that family members most, so they will take care of them. In the, if that person is not that much serious, they can take care in that family, in that home. If that person is becoming serious every time, so it's we have to go for that pharmacological, maybe, where such type of medicines are there, which will help detoxification with, means some high dose medicines also there, with the consent of that patients and that all the near ones. We can go for that pharmacologicals. If all these modalities will, means, not affecting, and the person is relapsing again and again, there are some medicines, and it is like I told that high uh, it's a high care. We have to take them in with very much that level of care will be very higher, that all these things, and here that support system plays a very much high role here, because a social worker cannot means be with that person for lifelong, that and government owned, mean government or any that person, that economic cost is also high. So here that support system, they have to understand that how that treatment will work with the higher care. That's only we can do at that stage. Okay.
Yeah, and also I think one thing we can also do is we can transfer the case to a colleague to handle. When we think that we have done our best and yet the problem persists, I think we can transfer it to a colleague to handle, so that we'll see the outcome also within some speculated time.
Yes. That is yes. We have in that case study. Like we can refer this case to some other person who, or we can discuss with them. Uh, it's a referral, like that what we have done with this case study. We can pass this case to another person. We can take help them or together or single handedly. We that also could be part of we can do with this case. Maybe that will help, taking reference referral system, or help taking help from same level post persons. So with this we have at least know that what could be how the treatment stages, and what are the treatment modalities, um, at least what we can do with persons with addicted, and we have discussed some important points, and so there are some prevention strategies which is every country has developed for every states or every communities. I have highlighted some strategies which is from our government of India. So you must have some other strategies in your localities or in your communities. Uh, just have a look. Do you have that some sort of relevant, some same strategies, or do you have any other strategies? Did you heard about that de-addiction camps from a locality? Anyone heard about the de-addiction camps? Hello.
No, ma.
Okay. So as I told, maybe it is different in your site, how the prevention strategies, maybe some, but most of the strategies are like awareness and preventive educations, which we can give in our called schools, colleges, then the drug awareness and counseling centers here in our communities. There are some per centers or like in our that some we have some SHG groups, self help groups. They have given responsibility to for the drug awareness and counseling centers are like in one districts, in one states, like 10 to 15 counseling centers are there. Treatment come rehabilitation centers, that all of you know, at least that is maybe common in your side also. Workplace prevention programs, maybe an example in that in factory setup, that they have some workplace rehab center. or the persons who are struggling with addictions. That is the workplace prevention program happening nowadays. Most of the corporates, they are in weekly, not weekly, but like yearly, they have having some sessions on this drug abuse, all these things. And de-addiction camps. De-addiction camps mostly organized in like tribal village, where they will educate them and give them uh, free detox service, free medicines for the addictions. That is de-addiction camps. All which I am discussing, it is some initiatives of our government of India. So you can go through in your means your government sites. You can understand the what are the prevention strategies which your government is doing. Then of course that NGOs, which is like universal, maybe in your site also, that NGOs who are working, who are afflicting the helping and drug abuse victims. There are so many NGOs, particularly they have worked for this drug abuse. Then another, that innovative interventions and community based rehabilitations. uh, this means that we have to give some new treatment approaches in our community for to fight that drugs. Some different innovative creative ideas we can give as a social worker when we are working in NGOs. Then next one is technical exchange and manpower developments. uh, that means it is to improve the quality of the de-addiction treatment by training professionals. As we have discussed that for this de-addiction, some trainings are available specifically to for this addiction program. Some specifically trainings are available, so we can recruit the training professionals and place them in the community based centers. The last one is surveys and studies, evaluation, research. Mostly this is done by the university. They collect the data and for the drug addiction, and they do research. They do national wise surveys. They do this. They publish the papers. So through these strategies are some comprehensive strategies which works for the prevention of the drug abuse in our government site, in our means government of India. So you can go through in your sites and see how what are the prevention strategies, and see the settings where a social worker can be placed. Uh, Here mostly we are in central governments, NGOs, or if you see the government organizations, there are some like mostly hospitals now they are recruiting social worker, MSW, and all these settings there. As a social worker, we can implement these treatment plans. So here today we conclude that how this treatment phases, treatment plans, detoxifications, the modalities we have understood. So I hope you get some concepts which will be which you can implement in somewhere, some place. Yes. Did you get some concepts today? Are you with me, students?
Yes, ma'am. We have a lot of them. We have.
Okay, thank you. And so this was like the gist or the main thing of here, this prevention and substance use, these concepts, and whatever you understood, that's are the that concept, and with this concept, at least you can think or imagine that how to treat a addicted person. And rest of the things, whatever in your 2 classes we will cover, that whatever we'll do, we need some skills, right? Whatever we do, we need some counselings as a social worker. Then how and what could be the skills required, how the counseling process, that the things we will cover in our rest 2 classes. Whatever we have learned, we need some skills, we need some counseling to do. Counseling is need in every stages. So what are the correct counseling, what is the ways of counseling, all the things we will discuss in our next 2 classes. I hope you are following my classes, at least today.
Yes, ma'am.
Okay, tomorrow maybe I will take 5 to 10 minutes more, because some little bit some small concept we will discuss, like maybe after 5 to 10 minutes extra. So be ready for that. Okay, is that okay with you?
Yes, ma'am.
Yeah, some I am trying to cover the main concept which I covered, but some small concept or some interesting which is also required, that will cover after the class. Tomorrow is one class and another class is one day after tomorrow, right?
Okay, okay, ma'am.
Yes, yes, yes. And because day after tomorrow is Tuesday, day after tomorrow we have leave. We have one very important festival here. We have one puja, which is celebrated like mostly for the Hindus, which we called. We pray to our God, Lord Shiva, which is a very big festival for us. That's why there is a leave, one day leave for us.
Okay, so,
Mahasivaratri.
All right, we wish you well on your festival.
Yes, it's a Mahasivaratri festival.
Ah,
Uh, yes, we pray to our Lord Shiva, and we offer. It's festival once in a year only. We celebrate only once in a year. It's a 26th of Feb.
so
I have already.
is it a national holiday? Is it a national holiday in India or is for
Yeah,
a
yeah, yeah,
specific
yeah.
sector?
No,
Ah, I
it's
see.
mostly say, government holiday. In
Ah,
private,
okay.
mostly they don't give holiday. So mostly in government, they will give holiday. Bec-
Okay.
And I told some, maybe you remember or not. I told in this festival only, like that's a tradition to offer a bhang to God, which is some sort of cannabis. Okay, so in our culture it's okay to have that bhang in that day. It's okay to have in that culture. But
That's
it's,
interesting.
yeah, but it's not okay to have rest of the day. Okay.
But only for this day.
Okay, only, but there is not okay to do any illegal activity. Okay.
Ah, I see.
Means it's not that a high dose, but very little bit, which was
Just
in our culture.
just to maintain the
Yes,
culture.
yes. That's
Ah, I
that.
see.
That's all.
It's
So
nice.
it's a practical concept where drugs abuse also and depends on culture.
Yes, culture can influence drug abuse. Yes.
Yes, yes. But some people
Right.
is abusing this. Okay, they do for all the day, all the months, all the years, which is not legal, not good. Also, that's the thing we have to keep in mind. And and today I think you have total 20 students, right, in your class? 20 students, right? Total
We
number?
should be more than 20.
Okay, more than 20.
But I think mostly we attend classes. We are around 20, but we are more than 20.
Okay.
Others,
Right.
we say commitments with work. Others networks.
Okay. Today I see at least 15. I feel really happy. Thank you for
Yeah,
joining.
today it was a good patronage. Yes.
Yes. I feel really happy. It's so thank you for joining, because it's like one time chance. No, it won't come. We won't have such communications in next times.
Exactly.
We all are social workers, so we are sharing our ideas. That's really nice, and we should do more often all these things. We all are social workers. Okay, so thank you. We'll definitely please meet tomorrow, and we'll discuss. Okay, thank you for today.
Thank you too.
Thank
Good
you,
Thank you,
ma'am.
madam.
Thank you.